My name is Hazel Grace Lancaster. I am 16 and I was diagnosed with stage 4 thyroid cancer when I was 13. Now the cancer has spread to my lungs. The lung cancer is going to kill me.
I believe we have a choice in this world about how to tell sad stories. On the one hand, you can sugarcoat it. It's just not the truth. This is the truth.
Hey, make some friends.
What's your name?
Hazel.
What's your full name?
Hazel Grace Lancaster.
Today I'm gonna blow up, and I'm gonna obliterate everything in my wake. And I don't want to hurt you.
You gave me a forever within the numbered days, and I can't tell you how thankful I am for our little infinity.
It's a good life, Hazel Grace. Okay.
Okay.
I am okay, but this is the story of the lung cancer that is going to kill me. Lung cancer is caused by multiple mutations in DNA. Sometimes the cancerous cells move from the original site of the tumor, which is called metastasis. There are two types of lung cancer: primary lung cancer and secondary lung cancer. Primary lung cancer is when a mutation occurs in the lung cells. Secondary lung cancer is what I have, when a mutation occurs somewhere else in the body and the cancer spreads to the lungs. Symptoms of lung cancer include coughing, pain in chest, difficulty breathing, changes in voice, coughing up mucus, and coughing up blood. Smoking is a major risk for lung cancer. Smoking causes more than 4 in 5 cases of lung cancer. Despite this, many people who have never smoked get lung cancer too. I have never smoked. Other risks include family history, air pollution, exposure to gas, and a lowered immune system. Sometimes there are just unlucky cases, such as myself, who have mutations in their lungs that cause the disease. Unfortunately for me, it is too late to prevent lung cancer. However, there are a few ways to lower your risk of developing lung cancer. The most effective way is to not start smoking and to minimize exposure to secondhand smoke. Also, it is important to get your home tested for radon, an odorless gas which the U.S. Environmental Protection Agency estimates to be the cause of about 20,000 lung cancer deaths each year. You can test for radon in your home using a do-it-yourself kit or by hiring a professional. It also helps reduce your risk of lung cancer if you limit exposure to any dust and fumes.
Some patients use an oxygen tank like me so the lungs can get air more easily. Small cell lung cancer treatment includes chemotherapy and radiation. A combination of chemotherapy and radiation can be used for limited small cell cancer patients. The most common chemotherapy treatment is etoposide and cisplatin, which is topazar, Vepicid, or platinol. Patients with extensive small cell lung cancer normally use chemotherapy alone. Patients who have limited small cell lung cancer and no lymph node tumors can receive surgery before receiving chemotherapy. Small cell lung cancer is when the cancer cells appear to have a large nucleus instead of a small cell and is normally caught early on. Non-small lung cancer includes squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. Squamous cell cancer is caused by smoking and develops from cancer cells in the airways and is normally found in the main airways. Adenocarcinoma develops from mucus-producing cells and is usually found on the outer covering of the lungs. Large cell carcinoma is when those cells look large and rounded and grow very quickly. There are 4 stages of lung cancer. Stage 1 is when the cancer is only found in the lungs and not in the lymph nodes. Stage 2 is when the cancer has spread to the nearby lymph nodes. Stage 3 is when the cancer has spread throughout the middle of the chest. Stage 4 lung cancer is when the cancer has spread to both lungs, the fluid in the lungs, and the surrounding areas. I have stage 4 thyroid cancer with metastasis in my lungs. The cancer began in my thyroid and then spread to my lungs. That's why I have to use an oxygen tank, because the metastasis isn't specifically treated. The mortality rate for lung cancer from the years of 2004 to 2010 was 83.2%. About 17 of every 100 people with lung cancer survived. I'm a terminal cancer grenade. I will not be one of the survivors.
For those people that are lucky enough to survive, there are several foundations that provide funding for clinical trials in search for a cure. The Longevity Foundation works to discover methods of diagnosis at an earlier stage, since 79% of lung cancers are diagnosed after the tumor has spread. An early diagnosis would increase the survivor rate, and statistics like myself would decrease. They have also funded roughly 100 projects at 56 institutions in 23 states, including at Yale University, Johns Hopkins School of Medicine, and Massachusetts General Hospital. There are hundreds of walks and runs each year that provide funding for research. This year, the National Cancer Institute spent $314.6 million on lung cancer research. For others with early lung cancer, this is great news, but I already know I'm going to die soon, no matter what new drugs are discovered. Kids with lung cancer are lucky enough to get a wish from the Make-A-Wish Foundation because we are all going to be dead in a few years. When I was 13, I used my wish to take a trip to Disney World, but you could go anywhere or do anything with your wish as long as it's not too dangerous. The genies, as I call them, grant a wish every 38 minutes in the US. There is still hope for everyone else, just not me. Thank you for letting me share my story, even though mine is considered depressing. There is still hope for everyone else.